Hi, I'm Lindsay and this is Kinda Healthy Podcast. Most people who have had a limb removed report that it sometimes feels like the amputated limb is still there, a phenomenon known as phantom limb sensation, but there can also be phantom pain. Pain alters the quality of life more than any other health-related problem. It can interfere with sleep, mobility, and emotional well-being. The concept of phantom limb pain is the feeling of pain in a body part that is no longer there. Doctors used to believe this post-amputation phenomenon was a psychological problem, but experts now realize that these sensations originate in the spinal cord and brain. The brain continues to receive signals from nerves that used to feel for the limb. Many experts believe phantom pain may be at least partially explained as a response to mixed signals from the brain. After an amputation, areas of the spinal cord and brain lose input from the missing limb and adjust to this detachment in unpredictable ways. The result can trigger the body's most basic message that something's not right: pain. Studies also show that after an amputation, the brain may remap that part of the body's sensory circuitry to another part of the body. In other words, because the amputated area is no longer able to receive sensory information, the information is referred somewhere else, from a missing hand to maybe a cheek, for example. So when the cheek is touched, it's as though the hand is being touched, because this is yet another version of the tangled sensory wires. The result can be pain. A number of other factors are believed to contribute to phantom pain, including damaged nerve ends, scar tissues at the site of the amputation, and the physical memory of amputation pain in the affected area. Some symptoms or feelings that can be associated with phantom pain are squeezing tight pains, stabbing, throbbing pains, muscle cramps, burning, a feeling of crushing, painful, unnatural position in the no longer present limb, shooting or shocking pains, itching, tingling, and even the sensation of trying to pick something up. Of course, the exact cause is unclear, but it seems to originate in the spinal cord and brain. During images scans like MRIs and PETs, portions of the brain that had been neurologically connected to the nerves at the amputated limb show activity when the person feels phantom pain. 60 to 80% of amputees feel pain in the missing limb, but some say it always occurs after sudden traumatic limb amputation. The pain usually begins within the first week after the body part has been removed, but it could be delayed by months or longer, and the pain can come and go or be continuous and last for years. In over half of the cases, the phantom sensations decrease gradually, and it doesn't seem to make a difference if it was a sudden need for an amputation because of an injury or a removal that was necessary due to disease. Phantom pain is less likely in very young children and congenital amputees, people born without a limb or part of a limb. Another common phenomenon is telescoping. Telescoping is the sensation that the phantom limb is getting shorter. At first, the phantom limb feels whole and gradually gets smaller. A patient may say it feels like the entire extremity has shrunk, so that the hand is now up to the elbow if that was the site of the amputation. It's a normal part of the nerve healing process and usually fades with time. Phantom eye syndrome is somewhat similar to phantom limb syndrome. The brain projects sensory information, making it seem as if it comes from the amputated limb or organ, in this case, the eye. The reasons for it are still a mystery to scientists. They don't know why the brain creates images and pain in an eye that's no longer there. 60% reported seeing colors and shapes, along with objects. People who suffer severe vision loss without losing an eye can experience similar hallucinations to people who have lost one. It usually happens in darkness or when a person is fatigued. In some cases, the symptoms stop spontaneously, but some people could stop the sensation by rubbing their eyes, blinking, or sleeping. Unlike phantom limb sufferers whose pain was immediate after amputation and affect younger people less, phantom eye sufferers start having sensation several weeks after the eye was removed and occurred more commonly in younger people. Pain was reported more in people who had discomfort in the eye before surgery and by those who were anxious and depressed. But some people said they saw more distinct images, resembling wallpaper, a kaleidoscope, fireworks, and even specific scenes and people. But then there were ghosts. Some people said they had seen strangers haunting their fields of vision. One man said he could see a figure walking alongside him. Another said they saw moving images of people and they disappear when I look right. Another patient reported they could see people passing them and they could see a light and items that weren't there. One woman said that in the dark she could see people. Another person said, "It's as though I'm swimming underwater through reeds. There's never any color." One woman reported that once she woke up to find an unidentified person standing next to her bed. Patients who made these reports had had surgery anywhere from as recent as 4 months ago to others who had surgery 4.5 years earlier. Strangely enough, some people found that the sensations they were experiencing were pleasant, and they had good experiences. For some people, phantom pain can get better over time without treatment, and for others, managing it can be challenging. Since different patients have different symptoms, doctors suspect that there's a range of causes. Human perception is a complex process. Even if they don't know why it happens, doctors can warn patients of the symptoms they could likely experience and the ghosts they might see. If you'd like to check out the articles used in this episode, I'll have links in the description. And thanks for listening.